Hello, this is Dr. Grande. Today's question is, what are the symptoms of predominantly hyperactive impulsive presentation with ADHD? So when we talk about ADHD, Attention Deficit Hyperactivity Disorder, we're really talking about three subtypes. So subtypes are different than specifiers in the Diagnostic and Statistical Manual, the DSM. They are mutually exclusive and jointly exhaustive. So if an individual is diagnosed with ADHD, they have to be diagnosed with one and just one of the subtypes. The subtype I'll be discussing here is predominantly hyperactive impulsive presentation, but there's also a predominantly inattentive presentation and a combined presentation. So for the predominantly hyperactive impulsive presentation, there are 9 symptom criteria and then other criteria after that are also used with the inattentive presentation. So starting with the first one, for the symptom criteria, we have fidgets or squirms in one's seat. The second criterion is leaves when sitting was expected. So we think of this criterion as mostly applying to children, but this could also apply to adults as well. If somebody was in a workplace setting, for instance, at a meeting, there would be an expectation to remain seated, and if they met this symptom criterion, of course, sometimes they would get up when they should remain seated in terms of what's expected for the workplace. The third symptom criterion is runs and climbs when inappropriate. Now this one, of course, definitely seems to just apply to children. When we're looking at adolescents or adults, feeling restless would be adequate to meet this symptom criterion. The next one is unable to play quietly. And if we think of this in terms of an adult, this is unable to engage in leisure activities quietly. The fifth symptom criterion is somebody appears to be on the go, as if driven by a motor. So internally driven, always moving. The sixth symptom criterion is talks excessively. The seventh symptom criterion is answers questions before they are completed. The eighth is an individual has difficulty waiting for their turn. Now again, it's not unusual to think of this as only applying to children, but it could apply to adults as well. And the last symptom criterion for the hyperactive impulsive set of symptom criteria is often interrupts. So there are a few other criteria, as I mentioned, that apply to hyperactive impulsive or to inattentive, so ADHD in general. An individual has to meet several of the symptoms seen in the hyperactive impulsive presentation or the inattentive presentation before the age of 12. So even if somebody's being assessed after the age of 12, before the age of 12 they would have had to have several symptoms, either in inattentive or hyperactive impulsive. Another criterion is that we see symptoms in 2 or more settings. So school, work, home, so more than just one setting. We also have a criterion here that indicates that clear evidence must exist that the symptoms interfere with functioning. And the last criterion is that the symptoms aren't better explained by another mental health disorder. So for the subtypes of ADHD, if an individual meets the symptom criteria for hyperactive impulsive for more than 6 months and does not meet the full criteria for the inattentive symptoms, which of course I didn't review in this video, that would be predominantly hyperactive impulsive presentation. If they did not meet the criteria for hyperactive impulsive, but did meet the full criteria for inattentive, that would be predominantly inattentive presentation. And if the full criteria are met for both inattentive and hyperactive impulsive, that would be combined presentation. Again, subtypes are mutually exclusive and jointly exhaustive. So an individual diagnosed with ADHD, as I mentioned, has to have one of these subtypes and only one. There are several risks associated with ADHD regardless of the subtype that's diagnosed. With children, we see decreased school performance, decreased academic attainment, and increased risk of social rejection. With adults, we see decreased occupational performance, increased risk of unemployment, and decreased attendance at work and other obligations. Now, we also see, in terms of mental health disorders, an increased risk in children to develop conduct disorder and an increased risk in adults to develop antisocial personality disorder and substance use disorders. So ADHD is a serious mental health disorder that necessitates treatment regardless of the subtype that's diagnosed. I hope you found this description of the predominantly hyperactive impulsive presentation of ADHD to be interesting. Thanks for watching.